Now, here's another disease whose potential to become a global pandemic cannot be ruled out. I'm talking about chikungunya fever. Cases of this disease are on the rise in China. More than 5,000 people have been infected. This has never happened before in the history of this country. Experts say the risk of this disease spreading to other parts of the world is an emergency. The World Health Organization has issued a statement. Here's what they say. More than 220,000 cases of chikungunya have been reported worldwide, including 80 deaths. And this is just the tip of the iceberg. Experts say the real numbers could be much higher because many patients with mild symptoms do uneven seek medical help. So the actual number of infections could be much higher than what we're being told. What is most worrying is that the virus has been detected in several regions outside Africa and Asia. In Europe, more than 1,300 cases have been reported. In the Americas, more than 600, mostly in the United States. And in the Eastern Mediterranean, more than 500 cases have been reported. At least 11 countries in the European Union have reported cases of chikungunya. The first case was reported in Italy in June. The patient was a 28-year-old woman. She had returned from a trip to India and Nepal. She developed a high fever, a rash, and joint pain. That's how she contracted the disease. She became the first person to pass on the virus to another person in Europe. Local transmission has now been reported in several other countries. In France, more than 250 cases have been reported. In Germany, more than 150. Spain, Portugal, and Sweden have also reported cases. What is the origin of this outbreak? Again, it's India. This is the largest outbreak of chikungunya in the country's history. More than 32,000 cases have been reported from 29 states. The worst affected are the southern states of Tamil Nadu, Karnataka, and Andhra Pradesh. So the virus originated here and now. It is spread to many parts of the world. And if that happens, can we contain it? Well, not so sure. There is no cure for chikungunya. Treatment is mostly supportive. We're talking about bed rest, plenty of fluids, and paracetamol. And since the virus spreads through mosquito bites, we can't rule out the possibility of a large-scale outbreak. It spreads by two types of mosquitoes, Aedes aegypti and Aedes albopictus. These mosquitoes also spread the Zika virus and the dengue virus. And finally, how deadly is chikungunya? Well, the fatality rate is low. Most patients recover within a week or two. But there have been instances of the virus becoming drug-resistant, which makes treatment difficult. So what should you do if you're traveling abroad? Well, take all the necessary precautions. Get vaccinated if possible. When you come back, make sure you get checked up if you develop symptoms. And this is important, not just for you, but also for the larger public health interest.